The Subject Expert Committee, or SEC, has recommended regular market authorization to Covishield and Covaxin. This effectively means that they could be available in clinics and hospitals registered, it seems, with Covin, and also chemists associated with clinics or hospitals can sell these, provided they are registered also with Covin. Let's try and break this up for us. Vishnu Shom also joining us with this breaking story right now. Vishnu, explain to us what this is going to mean. We're obviously getting just partial information at this point, but this really could be
Actually,
huge.
Ankita, it's not partial information at this stage. At this juncture, I would suggest that this is very much on the way to Covishield and Covaxin being available as boosters across the country. Now, the Subject Expert Committee of the government, it's an arm of the Health Ministry, has recommended the regular market authorization to Covishield and Covaxin with conditions. I'll explain all of this. Now, these vaccines, according to sources, will be available at clinics and hospitals which are registered with Covin, and at the time of administration of the injection or the vaccine by a hospital or clinic, this has to be all entered into the Covin system. Now, several weeks back, the Serum Institute of India had approached the government saying that, look, we have administered more than 1 billion doses around the world of Covishield, and the vaccine is well tolerated, it is extremely safe. And therefore, while emergency use authorization was given for the use of Covishield, why don't you allow full market authorization so that it can be available at pharmacies? As you know, neither Covishield or Covaxin are available in pharmacies. They are available in hospitals. They're procured by the government. The governments give it to hospitals. They are then administered. Whereas the Serum Institute of India, in the case of Covishield, which accounts for 90% of all vaccinations in India, said it's entirely safe. Why don't you allow this to be available in the market? Now, Bharat Biotech with Covaxin has done the same thing. They have applied to the government and said, look, can we please have regular market authorization? Can this be available, for example, in pharmacies? But it's not going to be over the counter. It's going to be through a prescription.
Right.
So the government, the Subject Expert Committee, has said that, all right, fine, this is okay, and that these will be available at clinics and hospitals, but then, the Covin registration process has to happen.
Right.
So if a doctor says you can go ahead and get it, you can get the medication, but you will need it'll have to be registered as usual on Covin. But this is absolutely fantastic news because it means that you would be able to get that booster shot. But there is one key question over here which is unanswered. What is the interval of the dosage? Is it going to be 9 months, as is presently the case, after the second dose, which is being administered to senior citizens with comorbidities? Or is it going to come down to 6 months, which is what a lot of people suggest that it should? Why? Because around the world, 6 months is the usual interval because the antibody count actually decreases by that time. So that's something we don't know about.
Right.
But assuming that this market authorization means the easy availability of this vaccine, then it can be bought up by hospitals, it should be available in pharmacies, and people who need a booster dose can actually get it. So that's absolutely fantastic news. Finally, Ankita, it needs to be said, this is coming at a stage when Omicron is beginning to wane in our big cities, which is at least in Mumbai and in Delhi, which is great news. What would have happened had this been available several weeks back? How many people could actually have gained that additional protection that they need?
So, Vishnu, help me understand this. You're suggesting that this means that, people of all age groups effectively
Correct.
could get booster doses. We don't know what interval that would be between the second dose and the third dose. But explain how this would work. Right now, it seems to suggest, the information seems to suggest that this would be only hospitals and clinics attached to hospitals which have Covin authorization already.
Yeah, that's the source so far. So this basically means that this is cleared for market use. So hospitals presumably and clinics presumably would be allowed to buy these from stockists of the Serum Institute of India and Bharat Biotech. You go there as you would for your normal vaccine dose, but all adults should potentially be given this particular, a vaccine, a booster dose is the assumption at this juncture. And which individuals? All adults above the age of 18. Children's vaccination has started in a certain age group, but they're not eligible for boosters right now. So it's all adults. Remember, presently, a booster dose is being given to those above 60 with comorbidities and frontline workers and healthcare workers and election commission officials, among others, because of the elections, but not to all adults. And there's been a demand that, look, you need to boost, all adults in this country. That the government said that cannot happen because only emergency use authorization has taken place, and therefore the priority is first to vaccinate those individuals, such as healthcare workers, etc., etc. So several weeks back, the Serum Institute of India, and then after that, I believe Bharat Biotech as well, approached the government and said, look, our vaccines are very well tolerated. Can you please open this up for regular market authorization? In other words, this will be stocked, and it now, we are told, will be stocked, perhaps not at pharmacies, which I indicated earlier, but certainly at clinics and hospitals.
Right. Vishnu, at this point,
stock over there,
yes,
you go and get your shot, which will be registered on COVID, presumably as a booster dose.
Vishnu, at this point, is there any information at all about whether, we could be looking at possible mixing of vaccines also?
That's a really good question, Ankita, and, that's what a lot of people had wanted. But at this juncture, the government of India's official policy is, no, we will go with a third dose of the same vaccine. This is despite the fact that both Covovax and Corbevax, that there are two separate vaccines available in this country, have been given emergency use authorization. But they have not been cleared in a mix and match situation. Whereas Covishield and Covin are available as vaccines for those above 60, etc., etc. So if you've had 2 doses of Covaxin, then you are eligible for a third one if you are above 60 with comorbidities. So the policy of the government is that the third vaccine should be the same, and therefore, at this juncture, we are not talking about Corbevax or Covovax. We are talking only about Covishield and Covaxin, Ankita.
Vishnu, I suppose the other question that comes to mind at this point is about the availability of vaccines and sort of regular supplies. Clearly, that's also going to be key going ahead.
Well, I can tell you, based on our source, what we've learned from our sources, that 300 million doses of Covishield are presently available in the country, stocked with the Serum Institute of India, which can be spread across the country in days. They've got both the Serum Institute of India and Bharat Biotech have got a very fast and well-lubricated distribution process. So the vaccine will be available as far as SII is concerned very fast. I haven't been able to speak.
Right. Vishnu, do stay on the line with us. We're being joined by Dr. Subhash Salunke, member of the National Task Force on COVID. And, you can ask him questions as well. But Dr. Salunke, thank you for joining us. Full approval for Covishield, Covaxin. Is this, in fact, now going to mean boosters for all adults also? And are we getting any information about what sort of gap there would be between second and third doses and when we can actually expect this to roll out?
I personally feel this is a very welcome development that the extension of access to the people who are interested in getting these the booster doses or whatever we can call third dose or whatever the designation or name that has been given. This is a very welcome step, and I personally feel that it should be accessible and it should be made available within the private sector. And from that perspective, if it is going to be available from chemists, from private hospitals, it is a very, very welcome step.
Okay, Vishnu Shom here. Just a quick question. At the moment, we are looking at a third dose of either Covaxin or Covishield, not a mix and match situation, right?
Yeah, at this stage, actually, that's what the Government of India or Health Ministry is indicating. However, we are requesting the National Task Force and Government of India to consider that now that it is proved beyond doubt, that's what they themselves are indicating, that mixing of these vaccines will be beneficial. So let's have that opportunity too. Once you get adequate data, once you get adequate information, and once you are convinced at the national level that it is worth doing this, then why it should be restricted to the specific areas or only in public sector? Let it be absolutely open throughout the country, both in the public sector and private sector. That will be extremely useful from the perspective of ensuring that people get adequate vaccines, booster doses, and that in turn is going to help us to ensure that this pandemic is going to be over into a form of what we call as endemic, maybe in the next few months.
Right. Dr. Salunke, who would pay, or who do you believe should pay for, a booster dose?
I personally feel anyone who has taken 2 doses and who has adequate amount of time that has been lapsed, and that should not be 9 months or 10 months. It could be as less or as adequate as 3 months or 4 months, should be made available irrespective. We are at this juncture, due to the logistics and due to availability of the doses, we are talking about 9 months, 60 years, and people having the comorbidities. These are all, kinds of conditions that we are putting, which are not in tune with the, ensuring people get adequate protection. Anyone who has taken 2 doses, who is required to be protected, needs to be given an opportunity and access to this vaccine. I mean, at this stage, it's okay. I can understand that, because we don't have that adequate number of vaccines that is likely to be available. But as and when it is likely to be available, let it be open for everyone who has taken 2 doses and have spent adequate time, maybe about, 90 days, and let it be open, and let it be open both in the public sector, also in the private sector, but let it be monitored. It just can't be that you take it and nobody knows what is happening. So monitoring through COVID is a very crucial issue from the national perspective. But access, both in the rural, urban areas, in the private and public sector, should be slowly ensured.
Dr. Salunke, the majority of Indians have been given Covishield as their first and second dose. Now, logistically speaking, what is this going to mean if we don't have clarity, in fact, on whether vaccine mixing will be allowed? Will that once again mean that more Covishield vaccines will have to be made available in the market?
At this stage, because right now, Government of India is saying that it is going to be homologous, and under the circumstances, we will have to, those who are taken like us, I'm waiting for possibility of going from, I have taken 2 Covishield doses. I would like to go for Covaxin, but it is not allowed, and so I'm just waiting. So if I'm allowed to take Covaxin, I'll be very delighted. But at this stage, without, delaying that, if I have taken 2 Covishield and I want to have a 3rd dose, I should be given an access and opportunity to take Covishield.
All right, Dr. Salunke, thanks very much indeed for joining us with your thoughts at this point. For all those of you just tuning in, an expert panel of India's Central Drug Authority has recommended granting regular market approval to COVID vaccines, Covishield and Covaxin, which are currently only authorized for emergency use in the country, subject, however, to certain conditions. Dr. Sunila Garg, member of the Lancet Commission COVID India Task Force and Director and Professor Community Medicine at the Maulana Azad Medical College, is also with us right now. Dr. Garg, your thoughts on this and what this is going to mean for India's battle against COVID?
I think this is a very good initiative because, if we make the vaccines available near the doorstep of the people, that means we are talking about the clinics, we are talking about the hospitals which are registered with the COVID app, that will mean that, people will be able to access those vaccines from where they want to. Right now, accessibility is one of the issues also. So in longer run, especially what we have seen with regard to children, they will be able to access, vaccines through their pediatricians and all that, through their family care physicians. But one of the most important things which will be very important is that the numbers should be accessed through COVID app. So that is important part of it. So I feel that this is a positive step in that direction. And also, even if the mixing takes place, let's say somebody has taken Covaxin or and is subsequently taking Covishield or, Covaxin, Covishield versus Covaxin. So I think heterologous combination should not also, at this point of time, affect the, total number of, it should not affect the booster, because it is important that, it has been proved that, even if you take the vaccine of different kind, that will be boosting the immunity more.
Dr. Garg, while somebody needing a booster can now purchase it from the market, there are certain conditions that have been imposed. This can only be administered in clinics and hospitals that are registered with CoWIN. Do you believe that that is sort of like an important check and balance to have?
That is important from the perspective of safety also, because any adverse event following immunization also needs to be monitored. And where, if it is clinic or if it is hospital, then one has got the emergency trays, the persons can be immediately taken care of, because you see, as of now, because all these are emergency use authorization vaccines, and otherwise also for routine immunization program also this protocol is recommended that the vaccination should be given in the settings where, the follow-up can be done.
All right. Dr. Garg, thanks so much for joining us with your thoughts on this big breaking story. Coming in right now, Covishield and Covaxin both now get full approval, full market approval, and this is no longer just emergency use authorization, and this could well pave the way for people to be able to take booster shots. Of course, still no clarity on when or what sort of duration would have to exist between the second dose and the third dose. All of that presumably will be information that becomes available to us in the next few days and weeks. But the big breaking story, Covaxin and Covishield now getting full market approval. There are some checks, some caveats at this point. These can be administered only through hospitals and clinics that have CoWIN authorization.